So this is the Iliacus pullback exercise. The setup is laying on your side with your feet up against the wall. Hips and knees are at 90 degrees, and then a towel roll between your knees and a towel roll or a foam roller between your feet, just to make sure they're staying hip width apart. The purpose of this exercise is to help stretch out any deep hip rotator tightness or pelvic floor tightness, and it just helps to get the hip functioning better and to get the head of the femur back in the middle of the socket appropriately, if that is what is causing issues. So the first thing we're going to do in this exercise, we're going to make sure we're in a pelvic tilt. So not arching forward, but tucking up and under, just keeping that pelvic tilt. And we're going to squeeze the towel roll. So use this top leg to squeeze down into the towel roll using only our inner thigh muscles or our adductors. So the important thing with this exercise is we want to make sure our glutes and our hip flexors do not turn on at all. They should be calm and squishy throughout the entire thing. So first, just practice being able to squeeze that top leg down into the towel roll without any hip flexor or glute activation. And that can take some practice. Just do a few reps there, and once you're able to do that, we can go into the actual exercise. Another thing to note is that the bigger the towel roll, the easier this exercise is going to be. So you can always double up on towels if you need to, or if you're having a hard time kind of getting that inner thigh muscle to activate. So once we go into the actual exercise, we're going to pull this top leg back. So think about pulling your femur back into the socket. So it's not like a big hip opening or trunk rotation, but you will have a little bit of movement. You're just really thinking about pulling it straight back into the socket. If you can see my leg just kind of coming back and in, but you want to do that using these inner thigh muscles and squeezing down to pull back, again, without activation in hip flexors or glutes. Okay, so tilt the pelvis, exhale and squeeze, and pull back. I like to keep a hand here to make sure that my hip flexors or my glutes, you can even do it like this just to make sure that everything else is calm. And one thing that you can do if you're having a really hard time keeping either one of those muscle groups out of it, you want to make sure your feet stay flat up against the wall, so you don't want them popping up on the heels or on the toes. You can also shift your body forward or shift it back a little bit. Just play around with it, see what works best for you. One other thing to do is to use the foam roller instead of a towel, because that can help facilitate that rocking back motion. So the foam roller should actually rotate or spin towards you, and that's how you can kind of tell if you're doing it correctly. So you want to squeeze and then pull back, squeeze down and pull back, just like that.